inception in 2005, the National Health Insurance Authority has been at the forefront of advancing health insurance coverage in Nigeria, working around the clock to bring more Nigerians under the health insurance net. The NHIA doesn't work in a vacuum. Rather, it collaborates with health facilities and stakeholders to achieve its statutory mandates. In recent times, the NHIA has witnessed tremendous improvement in its service delivery in facilities in Enugu State. Such services as drug administration, consultation, NHIA cost-sharing intervention, CMONC, among others, have rapidly improved. In this eye-opening journey, we are going to assess and evaluate the performance of the University of Nigeria Teaching Hospital, Unth, Itukwuozala, Enugu State, with respect to the services delivered by the NHIA.
So the satisfaction level is high, both amongst the staff and the patients. We're expanding services largely, at the lab level, at the pharmaceutical level, everywhere. We're employing services. We've trained a lot of manpower in specialist care. So the patient satisfaction rate is high and will continue to go high. So the more people we have, we're good. The out-of-stock syndrome is something that has bedeviled this hospital for a while. It's quite difficult, okay? But what has happened now is discipline has entered the matter. We are now more disciplined. So what it means is that when we get money from the payment that we receive, we map out enough money to ensure that we don't have any interruption in the drug supply. The federal government has shown a lot of commitment towards Medicare. This CMONC program is one of such commitments. That is, the federal government and the NHIA. So the CMONC project is a fantastic project because a lot of patients, a lot of people out there cannot afford these services. And for federal government to actually propose to take care, and they are doing that, take care of indigent patients with emergency obstetrics complication is a big deal. It's a game changer, and I hope it continues. Because really it has given hope to the common man. I must say that in the past 2 years or so, I have not received any negative feedback. I mean, let me say the last 1 year, it's been positive all through about NHIA. When you have NHIA breathing down your neck, because they have a lot of their patients get back to them, they feed back to them. So if you have NHIA breathing down your neck and trying to force you to do things well, trying to monitor you, trying to audit you, all those will help you to step up your service. So you find that the level of service that we're offering here continues to go up because NHIA is by the corner.
Other key management staff of the hospital have this to say about the fruitful partnership between the facility and the NHIA.
Because our people are poor, that results in the fact that patients cannot access this care. And as such, the CMONC program, which has really helped by way of making healthcare delivery for pregnant women and neonates free, has really helped to reduce maternal mortality and neonatal mortality to a reasonable extent. So you imagine a woman in a village that can't access care in a tertiary hospital like UNTH, where we have specialists, but because of this program, they're able to access such kind of care, and as such, complications that will arise in pregnancy that can lead to maternal mortality or even neonatal mortality is somehow averted, and as such, drastically reducing maternal and neonatal mortality. Then talking about the NHIA Roach program, I can speak more on that because I'm coming from the background of hemato-oncology. Being a hemato-oncologist, most of our patients that have hematologic malignancy are such that they will need drugs that to treat their malignancy that are costly. Talking specifically about rituximab, which is the one that we use in hemato-oncology, it is quite costly. And I've seen patients over and over die from hematologic malignancy just because they can't afford it. So when Road stepped in conjunction with NHIA and had this partnership that drastically reduced the cost of rituximab. There are many other anti-cancer drugs in that category, but I'm speaking specifically for rituximab. Patients have really benefited. First of all, need NHIA to get enough people to be aware of the program. In fact, it was recently that one of my friends told me that he just heard about the gift ship program because all this while he felt that there is no coverage for the informal sector. So I feel much effort should be made to get Nigerians to know about the programs of NHIA. Then I also strongly feel that chronic illnesses should be strongly considered.
Services have greatly improved, largely because of a very proactive management, imposing greater sanctions or putting more pressure on few recalcitrant HMOs that don't pay up as and when due. When these payments come in form of fee for services and capitation, that you can actually leverage on them to ensure that supplies are maintained. The programs we are running, like the CMONC program that is tailored towards indigent mothers, that one has placed us on a very almost in the global map, because each time people come here, they applaud what we are doing. So I'm impressed. In a scale of 1 to 10, I will give us 8.
Most providers, especially UNTH, has gained a lot because this is a game of numbers. The more enrollee you have, based on the services you perform, then the more tariff, the more capitation and fee for service you also have. So for UNTH as a hospital, yes, we have. It has actually increased our IGR. There's no gainsay about it. Our capitation is running into thousands, and this is what we get every month. And the utilization is obvious. We use it to source the issue of out of stock and then improve our services, like issue of having the requirements for lab services. It's not something we just rush to the market and get now. Right now, we have contractors that supply. Same with drugs, because we have the money to purchase it. And apart from that, NHIA is like a fund you invest, and then people go to town and tell your story. Because when you give enough services, adequate services, you don't need any advert anymore. People go to town and tell your story.
For the UNTH NHIA coordinator, Dr. Chinonso Igwe, services offered by the NHIA have in no small measure uplifted the image of the facility.
Majority of the enrollee, what we've noticed that they are happy with the services, they enjoy the way we bring them services, and they want to come. But occasionally, some, due to one delay or another, escalate and are very troublesome. And we also find way to calm them down and make sure they get the service they need as at when they need. I feel if they will make it like, if HMO doesn't give a code, either accepting or not accepting, after 1 hour, whatever code that is given by NHIA directly becomes automatic and becomes the final code, instead of going back again and waiting to confirm.
Other key staff of the facility continue with the good narrative of the intervention programs and services delivered by the NHIA in the facility.
We're very happy that the CMOC program even started here in University of Nigeria Teaching Hospital. And then since it started, I must say that our indigent women have been, we have been able to provide services through the CMOC program. However, when they come, you know what pregnancy is all about. Usually they present in the night, or most of the time is an emergency. So, and just like CMONC it's comprehensive emergency obstetric and neonatal care. So it's our own, as a department of obstetrics and gynecology, we determine whether it's an emergency. Okay? Then As for the other criteria, which is the indigency, there is a committee that will tell us whether this person is eligible to be under CMONC or not. So ideally, this, as women who are the bedrock of society, every woman who has an emergency obstetric condition should ideally have the services of CMONC. It should not be limited to those that are criteria-wise indigent. That's one. And then secondly, we also noticed that for women who deliver at home, according to the Nigerian Demographic Health Survey of 2024, 56% of our women deliver at home. So there is no reason why, because a woman delivered at home, so she brings her baby here and then the baby is not eligible for CMONC services. That is lack of justice. No,
They are doing well in helping us alleviate the suffering of the vulnerable patients that don't have enough finance to take care of their treatment. Then in formal sector, like the workers, the people that the employee that are under NHIA, they access the services well. Then those that are not under NHIA, the businessmen, the market women, the farmers out there, they are still welcomed into the system because of the program that is called SAMO, Comprehensive Emergency Obstetric and Neonatal Care. We encounter some challenges like some patients that come, the CMO patient now specifically don't capture babies because neonatal care is included in the services. But you find that some women that deliver at the outstation, the maternity homes or private hospitals that don't have enough facility to take care of the neonates that have problems, when they come to our facility, the nature, the seems not to capture those groups. So we need to ask the government to help us so that those groups will be included into the group. Now, another group, we know the vulnerable are there. They are the people that are meant for it. But you find out that some groups now, they are not vulnerable per se. But when they come to hospital, considering the care, the amount of money, the hospital expenses, and the hospital bills, you find out that they now shift into the average citizen to the vulnerable group because they can't afford to pay their hospital bills. Some of them, after discharge, CS, for example, you find that an average Nigerian cannot afford to pay for CS, considering the economic status of the family. So we are pleading that those groups, the 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 program will make shift so that it will capture those people. So that after discharge, if you see after that the patient cannot pay, let's enroll them into the scheme so that they will benefit from the scheme. The message to NHI is please, how the patients that are captured under CMOC, you know the cost of hospital care is expensive. They will be remitting the money to the management so that we will have enough drugs and those things we need to take care of these patients.
Some of the challenges the enrollees pose to the healthcare team in my department. One, with more sensitization, we have greater number of patients being enrolled into the scheme. And this has increased the day-to-day workload that we have, also increased our consultation times. That's one of them. Then two, the enrollees, for one reason or the other, also have, for every encounter you have the doctor's agenda and the patient's agenda. Some of the enrollees also come with their own agenda, which might not be in keeping with what we want to give them. Upon registrations, the enrollees have to wait for quite some time, I think 3 months or thereabout, before they can access care. This is actually a problem because when they come, they want to register and begin to access care immediately. Then also this issue of codes for referrals. Sometimes the enrollees might have to meet secondary referrals or code for secondary referrals. And when they're being treated for a chronic situation, the NHI policy has it in such a way that they have to keep revisiting the code, maybe on a monthly basis,
So when someone needs care for about a year continuously, they keep coming back to us with complaints. So they have to come back every month to renew their code and all that. If this could be made for a longer period of time to help the patient back and forth, it would be good.
At the NHIA pharmacy, UNTH, various drugs are on set, with staff working assiduously to attend to the patients and combat out-of-stock syndrome.
For some time now, I would say for the past 8 months, we have not been experiencing out of stock here. Prior to that, we were not working with proper quantifications, so we're not bringing in enough drugs that will last for a season. We don't experience difficulty. Why? When we started this place 4 years ago, the first thing we made sure we did was to key in NHIA medication price list into the system. Because when I looked at the price list, I found out the only way we can satisfy the need of enrollees is to work according to the approved price list. It doesn't matter the price. So what did we do? We took the NHI medication price list as at then 2022. Now it has been updated 2025. So we make sure it is keyed into the system with the approved price. So what do we do when we want to procure? We procure according to that price medication list, from anesthetic products down to oncology products. So that way we cover every range of patients that will come for our services. When we run out of drug, there are two things we do. We either source from our DRFS section, because it's coming in as an emergency. We go to them. If they have it, we borrow from them and we reconcile later with them. And then we also have an emergency approved money always available that we use to procure emergency drugs. Apart from that, the rest of the drugs are covered when we do the procurement.
Dr. Vitalis Okwo, Head of Department Oncology, University of Nigeria Teaching Hospital, Itukwozana, takes us around the incredible state-of-the-art facilities for managing cancer patients.
So this is one of the places that patients do have challenges in receiving in terms of the cost, because the cost of this is over 1.6 million. And some of them have been benefiting from NHIA. I think they receive about 400 or 500,000 thereabouts. And part of the challenges, as we discussed before, is that if the money does not come within the periods, they may not start or their treatment may be delayed.
There are enough benefits because here patients pay out of pocket, and most of the times they don't have money, or they must have spent a lot before coming here, and they're supposed to get the standard care here. By the time they come here, they must have wasted funds elsewhere, and they will not have enough money to complete their treatment. So it helps a lot. Finance is the major challenge here, so it helps a lot to make treatment faster for them. Any support means a lot for a cancer patient, because it's more like continuous expenditure that they incur. So any support elsewhere means it gives them a lot of relief, hope, and confidence that they have someone and the government is beside them. In short, it means a lot, because you also have to help them to inform other patients they know but may not have access to, that here in this facility treatment is cheap because it's subsided. Yes, we know that the NHIA is in existence. A good percentage of the patients we interview don't know about it. So after observing that, we make sure that once the patient opens the case file here, there's a health talk that is given to them. The navigators will also come and introduce themselves and introduce the NHIA program to them.
At the postnatal section of the facility, CMONC beneficiaries and their relations recount first-hand account of the program and the advantages to them.
Oh, I appreciate a lot. They try for me. God will bless them because they saved my life. Since 2 weeks now, I'm here. At least my mind, I have rest of mind. Some things that I'm supposed to be buying with money is free.
They have saved the life of my wife. Ebe nwa mụrụ ya n'afọ, enwe m onye enyemaka, 8 pints of blood, but they continue to help me till nwaanyị anọrọ ndụ later. I'm so grateful. I'm happy. In short, I'm one of the happiest men seeing this woman alive today. I bless all of you. God will continue to favor you.
I'm so much grateful. Obi dị m aṅụrị ọfụma because na ọ bụ na ọrịa aka m na ebe a now. Nwa m ike nọ nna ya dị one thing or the other hapụ m. On Thursday ka ha bịa ọbụna na na-enwe contraction ọ kweghịzi controllable. So ebugabazie m theater mee m operation for even the blood use 2 pounds of blood. We didn't pay for it. They helped us a lot.
I think it's very, very important to extend this care to the elderly ones. Because when you come here, for example, at times we normally have some elderly patients, they discharge them, they don't have money to pay for their treatment.
Some dutiful NHIA desk officers were seen attending to patients and their requests.
On a daily basis, we used to see up to 120 patients a day. So monthly it should be about 3,600 patients a day. No, we don't have much challenges. The only challenge I can say is delay in getting authorization code. But we have this directive from NHIA that anybody that is up to 1 hour who came here to solve for code, once the person stayed up to 1 hour, we can give the person what we call temporary code.
The Enugu State Management of the National Health Insurance Authority has left no stone unturned in the quest to deliver quality health care insurance services to the people.
The introduction of our new platform from the old platform to the new one that makes it very seamless by using just the NIN. Once you input the NIN, every other details will come up and it makes it very seamless. We didn't want to 30 seconds to 1 minute, you're done with a registration. And then also we have introduced another innovation of call it self-portal, where you can register for NHIA at the comfort of your home. That one you just enroll into, you enter into our portal with www.enrollment.nhiaonline.com.
We cannot be 100% to say that everything is going on 100%. We are not perfect, but I believe that in the recent time, the state office swung into action and ensured that some of the desk officers and all the service providers received adequate training on NHI operational details to ensure that they carry out these functions without delay. For now, we are very well, we are driving, we are sensitizing people to know it's not easy. Most people to believe and trust in what you are doing in a federal government project, so it's so difficult. But we are trying our best to let them know that this one is not that what they will say. This is that project, that this is reality, and people who have enrolled under this program are testifying that the program is worthwhile.
Is this sustainable? Yes, it is sustainable. Now I can boldly tell you it is sustainable because we have a government who have looked in and they've discovered that the only way to take care of over 200 million Nigerians is to come up with a health insurance, something that will cater for their health. And that is why they made it a mandatory health insurance. You know, initially it was just for people in formal sector working with federal government. But now it is mandatory for everybody. Remember, our mandate is universal health coverage. And when you're talking about universal health coverage, you're referring to those who can afford and those who cannot afford. That's you're talking about the vulnerable and the impoverished. The denominator of the benefits of what you get from enrolling is that you have access to care. Health insurance means a little bit of money has been kept aside while you are still held for when you will need it. Lack of awareness is one major problem that we have. The second is people's attitude to health.
Without any iota of doubt, healthcare service delivery at the University of Nigeria Teaching Hospital, Itukwuozara, Enugu State, has reasonably improved. The driving unsung heroes of this development remains the NHIA and its intervention programs. Behind this drive in the state is the new management of the authority. The state coordinator and the team of dedicated staff have done absolutely well to improve healthcare accessibility for Enugu and beyond.